more patients than nurses can handle. That's what complaints from PeaceHealth Riverbend clinical staff to the Oregon Health Authority allege, leading to $500,000 in proposed fines. OHA's website shows dozens of complaints against PeaceHealth, including two the hospital has already paid. Last June, those two complaints said nurses in the NICU were left with more patients than was safe, costing PeaceHealth $16,000 total in fines. Still, $500,000 in proposed fines remain. And PeaceHealth tells us what the hospital could end up paying comes down to how the law is interpreted. Oregon's nurse staffing law sets mandatory unit-specific nurse-to-patient ratios and requires hospitals have a written staffing plan approved by a nursing staff committee. In 2023, Governor Kotek tagged on financial penalties.
Safe staffing saves lives. Having the right amount of caregivers at the right time for their patients means that healthcare is more affordable, it's more accessible. We get patients out of the hospital and home faster. They're less likely to be readmitted. When PeaceHealth is getting these violations, can be for a number of reasons, but often it's because they don't have the right number of caregivers in the right place at the right time, and that's not safe.
The hospital neither confirmed or denied there were still departments without staffing plans, but said in a statement, PeaceHealth's priority is always high quality patient care and is committed to continued staffing compliance. Current nurse to patient ratios at Riverbend are among the best in the industry. Like many hospitals around the state, PeaceHealth seeks additional guidance, clarity, and interpretation on this new law. Riverbend leadership will continue to collaborate with our nurse staffing committee. Meanwhile, Mealy says a change in PeaceHealth leadership now presents a big opportunity to make improvements, with Hope's interim chief executive officer, Heather Wall, will take steps to create the remaining staffing plans.